Dr. Steve,
Hey.
Dr. Scott, Casey.
So,
What?
Hey,
Whoops.
Dr. Steve,
Oh,
got a quick
sorry. Well, I was going to answer for Tacey. Let's try that again. Okay.
Hey, Dr. Steve, Dr.
Hello.
Scott, Casey,
Hi.
whoever else is there. I
How
wonder
you
if you
doing?
could expand some on people that have Meniere's disease.
Okay.
I've had that for 30 years and comes and goes, but here late this spring, it's coming. It's staying for 2 or 3 months.
Yeah.
Can't get it to clear up, but I was reading about a new drug, Ebselen, Ebselen, that they were in the trials on. I was wondering if you could tell me if that is available or is it restricted in the U.S. or something about it. Anyway, thanks a lot. Bye.
Okay, man. So let's talk a little bit about Meniere's disease. The most famous person I know that had Meniere's disease was Alan Shepard, the first American astronaut. And he ended up going to the moon despite having Meniere's because they did surgery on his ears. They did a pressure equalizing surgery in his inner ear to fix it. And it was he was desperate to get relief because he really wanted to go to the moon. And but anyway, what Meniere's disease is a disorder of the inner ear that causes vertigo, tinnitus, noises in the ear, hearing loss, and sometimes a feeling of fullness or pressure in the ear. And it tends to come and go, but sometimes it comes and stays. And the exact cause is unknown, but it is associated with an abnormal amount of fluid in the inner ear's labyrinth. So for whatever reason, it starts producing too much fluid, pressure build up. Now you have these abnormal signals going to the brain causing vertigo, and like the room is spinning. Vertigo is different than lightheadedness. Lightheadedness, you feel like you're going to faint. Vertigo, the room feels like it's spinning. If you've ever spun yourself on a bar stool and then stopped and the room, you're dizzy, quote unquote dizzy, then that's vertigo. What we usually use for this in the simple cases is a diuretic called hydrochlorothiazide, and it just helps to reduce the fluid buildup. That's it. Low salt diet, limiting caffeine, those kinds of things. But then surgery can be the thing. So now Ebselen is. Can you look to see if it's been released in the United States?
Sure.
I know that in December of 2024, the company making it announced positive phase 3 results for it, but I don't know if it's been released yet. But it acts as a thing called a glutathione peroxidase mimic, which is an enzyme that's involved in reducing inflammation, and particularly in nerves. So this stuff may have a lot of different applications, but one of those could be Meniere's. So let me see. So Sound Pharmaceuticals completed a phase 3 trial showing positive results in improving hearing loss, tinnitus, and dizziness. So look, go to clinicaltrials.gov, put in Meniere's disease, and put in Ebselen. That's Ebselen. And you may be able to find a clinical trial. Well, hell, this is not SiriusXM anymore. Let's just do it. Let's go to clinicaltrials.gov. Clinicaltrials.gov.
There's a
Oh, you're doing that?
Yeah.
Oh, you were doing it. Okay, good. Thank you.
Let's see here. Study start is supposed to be 2015. So it's been started. They're in phase 2, phase 3.
Okay, there's one that's not yet recruiting.
Yep.
There's an open label trial, and I would get on that right now. It's they have 4 locations. Oh, no, wait, sorry, 6 locations. South Carolina, Texas, Pennsylvania, New York, Miami, and Boca Raton, Florida.
There you go.
And then the rest of them, there were 4 studies on this. The rest of them have been completed and have data. And then one of them is getting ready to get cranked up, and they're not yet recruiting, but you could email them and try to get this drug. So apparently, let me see if Ebselen FDA approval. Let's see here. Not yet received full FDA approval. Okay, so it's coming. Looks good. The phase 3 studies look pretty decent. And remember, phase 3, those are the larger studies right before they go to apply for FDA approval.
Gotcha.
Okay. Let's see here. They're also looking at, this drug to be used to decrease hearing loss during and after cochlear implantation and antibiotic-induced hearing loss. There are antibiotics that will cause severe hearing loss, one of those being gentamicin. But if it's dosed properly, it tends not to. There's a guy named Felix Cerubi who invented the nomogram that they use to this day for dosing this antibiotic called gentamicin. Felix Cerubi was at the University of North Carolina and then moved to East Tennessee State University, and I think now he's retired. But if they gave Nobel Prizes out for reducing kidney loss and hearing loss, they would give him one. Because these drugs, before that, people had dosed them, and you just never knew.
Oh, wow.
You know, all of a sudden you'd walk in a patient's room, and they'd be like, huh? You know.
Oh, geez.
But anyway, and then noise-induced hearing loss. They're looking at Ebselen for that, too, and then for cystic fibrosis.
Oh, wow.
Yeah. Well, because cystic fibrosis patients get a lot of IV tobramycin, which is an aminoglycoside antibiotic like gentamicin is.
Gotcha.
And they get it a lot, and they get it inhaled and all kinds of stuff. So anyway, yeah, that's cool. Very cool. So, yes, thank you for pointing us to that.